Hey everyone, my name is Sayre. I'm our esthetician over at our new Floyds Knobs location in Indiana. I just wanted to jump on here today and kind of talk to you guys about some common myths we have concerning chemical peels. They can be intimidating to some of my patients, so I just want to get on here and kind of bust some of those myths for you. The first myth I want to talk about today is that your skin is always going to be red after a chemical peel. So with a chemical peel, when we apply that peeling solution to the skin, it is removing those outermost layers. That's what gives you that beautiful glow. And in doing that, dependent upon your specific skin, you can experience some redness, some sensitivity in the days following. This doesn't mean that your skin is going to be, a huge amount of red and raw. It just means that the peel did its job. It's doing what it's supposed to, and this is actually an expected response. Some of my patients are only red for a few hours following the peel. Some are red for the rest of that day, and then by the next day it usually subsides. Then you go through that peeling process, things like that. But no, it's not always going to be, insanely red. It's a normal expected response. The second myth I want to touch on is that chemical peels can be performed by anyone. So this is true. You can buy over-the-counter peels. That being said, those peels are going to be way lower concentrations than what we perform here in the office at CaloSpa. This is due to the fact that I work under a physician, so we do have access to medical grade peels, which in turn is going to have a much higher concentration. So at-home peels are popular, they can be done, but I would encourage you to come in at least for your first peel so someone can look at your skin, kind of decide what's the best route to go for you. You don't want to risk damaging your skin at home. So I would say the best way to go about it is just to come in, let one of us look at your skin to determine what peel would be best for you, and then go from there. All right, the third myth I want to touch on kind of is similar to that last one we talked about, and it's that at-home peels are just as effective as physician-directed. This is not always true. Like I said before, those physician-directed peels are medical grade. They're going to be much higher in concentration. That being said, when you do come in the office for peels, there's multiple things we have to consider on a patient-by-patient basis, what they're using at home, on any medications, skin type, skin tone, texture, all of the things go into consideration when you are wanting to receive a chemical peel. So that being said, I do believe it's better to get it done by someone who is experienced in the skin, who knows what they're doing, what they're going to be looking for, because you're going to receive a deeper, a better peel in office just because it has higher concentrations, and you are going to be receiving it by someone licensed to do so. The fourth myth I want to talk about today is that you only need one peel to get great results. While one peel can bring on great results, it is best to do chemical peels in a series of about 3 to 5 peels, a certain amount of time apart from each other. This is going to give you the optimal result. It's going to allow that skin to regenerate in between each peel, and so each time you're going to see more and more of a difference in the skin. So for optimal results, we definitely recommend about 3 to 5 chemical peels, just depending on the patient and what they're looking for. The last myth I want to talk about today is that chemical peels cannot improve acne scars. So this is a big misconception. While acne scars are one of the hardest things to improve in skin, chemical peels over a certain amount of time actually do a great job improving that tone and the texture of the skin. Between each peel, the skin is going to regenerate, which is in turn going to fade more and more over time, help out with that texture of the skin, smooth out those acne scars, any, hyperpigmentation, any post-inflammatory pigmentation, anything like that. It's going to help to fade that over time. So chemical peels actually do a great job when talking about acne scarring.